Hi, good morning, everyone. Welcome to our Unit 3 discussion here in ST115. We're going to talk about environmental hazards in the OR and surgical services. So along with that, we have to discuss our role as a surg tech and what those environmental hazards might be and how we can maybe mitigate those risks and what we could do if something does come up. We'll talk about surgical conscience as it applies to those types of things. So here are your assignments for this week. Excuse me. Not quite as many as usual, but watch this 50 points here, and your discussion again is worth 40. So make sure when you do your discussions that you're going back later in the week, Saturday or Sunday, responding to 2 of your peers for full credit. That's going to get a lot of points taken off if you don't. Also, make sure you're putting some sort of sources for APA. You have to have something to back up your opinion, because really at this point, most people aren't going to know enough to form a full opinion on their own because you're not working as a surg tech, right? So make sure you put those, otherwise a lot of points are getting docked, okay? So I don't want that to happen to you. All right, so what happens if there's a fire inside the operating room? This isn't something that typically most people think of. I think if patients truly realized all the environmental hazards that occur in the operating room, I think they'd be even more scared to have surgery. They're scared as it is, but they don't think about things like, what if I catch on fire? Or, um, stuff like that. They're more concerned usually with anesthesia or pain or something like that. But fire is a huge risk in the operating room. There are so many things that can catch on fire or that can start a fire. We'll talk about the fire triangle and what is in the operating room that specifically is a concern. But the 3 things you can do immediately to protect the patient and stop the fire if one does occur in the operating room. First thing, and this is really more of anesthesia, but you should know where these shutoffs are too, is to shut off the flow of gases to the airway. So the operating room is an oxygen-rich environment because our patients have to have oxygen to survive, right? We have oxygen tanks, we have oxygen tubing that goes into the room, so it's highly oxygenated. You also want to remove the burning object from the surgical site. You don't want it to continue to sit there and burn on top of the patient. It's going to get worse. So try to remove that as best as possible. And then assess the patient for injury and respond appropriately. So there are a couple other things we'll talk about later as to what else we could do. Excuse me. Everyone in my family is getting sick. I think they gave it to me. So risks. We have to talk about risk management. We've kind of talked about this a little bit, I think, in the past with, if you have an incident report, you have to fill out something happened, it goes to the risk management department. That's kind of along this line. So what are the risks? How do we acknowledge what they are, know what they are, so you can plan for them? If you have a case that you know is going to be near the head and neck, maybe it's highly oxygenated, anesthesia has to use oxygen. How can we make a plan of action to maybe prevent that, to prevent a fire? How can we keep monitoring it during this situation? So this is huge for every case. No, it's just constantly keeping that in your head, thinking about what could happen. How can I fix it? That's part of your job too, not just passing instruments. It's a lot more than that. Okay. A lot of types of hazards, not just fire, that can occur. We've got technical, chemical, biological incidents that could happen. So it's important for you to be aware of the risks so you can take preventative actions. Right? So I mentioned this fire triangle at the beginning. You need to know these 3 things here on this triangle. These 3 things are required for a fire to occur. If you can eliminate one of them, you can eliminate a fire. So oxygen, heat, fuel. We've talked about oxygen. Heat sources. I listed all some options over here on the side. So heat would be like your Bovie, your ESU, your Bovie pencil, your laser cords, laser fibers, fiber optic light cords. Sometimes the ends of those light cords that go to your scopes, your laparoscopes, whatever, can get very hot. If you lay that, even if it's on like 5%, and you lay it on the patient's drape, it can catch a hole in the drape. on fire. I've seen it happen. Okay. Faulty electrical equipment. Sometimes maybe there's, always check your cords, make sure there isn't like a little hole, or maybe it's been bent too many times or something, and now the electric can actually escape the cord. As far as fuel goes, drapes. Not all drapes are fire retardant, so keep that in mind. They do make some that are. Hair, if you're working up, in the head or beard, maybe that is a fuel source. It just catches right on fire. Okay. Non-metal airways. So anesthesia, if we're in that area with the potential for a fire, we'll use a different type of endotracheal tube. They have special fire-resistant, more of a metallic type of airway instead of plastic that would just melt right down the airway, which has happened. And then prep solutions, especially alcohol-based, will burn. Like your ChloraPrep, for example, is alcohol-based. Intestinal gases, this is not one most think about unless you've seen certain movies. But anyway, if we're working, let's say sometimes we're doing like something near the prostate, for example, we have this patient up in stirrups. We actually will often pack the rectum with moist, like maybe a moist lap, so gases don't escape. Okay, if we're using bovies down there. So oxygen we kind of talked about. So O2, really, the air you breathe is not 100% pure oxygen. It's about 9 or 21%. But when we put like the cannula on the nose or a mask, we can make it pure oxygen. So it would be highly oxygenated, right? So head and neck airway procedures are at really the most risk for having some sort of fire, just because all three of these are present and very close together. Okay. So going back to your alcohol-based fuel or your prep solutions, ChloraPrep I had mentioned, there's a few others. This is one common brand. There's others that occur in like this little stick form. But with ChloraPrep, you want to make sure that after the circulator or you have used it on the patient, you want to wait 3 full minutes for the ChloraPrep to dry. Because if you don't, if you just wait maybe 1 minute, this is still moist enough that if they were to take the bovie down the skin, it could catch on fire. Okay, so a lot of places after they ChloraPrep might even set a timer. Each OR should have a timer. We'll set it for 3 minutes and then they can put drapes on top. You can't even drape before 3 minutes have been up. You don't want it to stay moist under there. You also don't want the prep solutions to pool, not in the belly button, not along the edges of the patient. So watch for those things. Sometimes they may, if it's along the edges and that's not where we're working, the circulator may take a towel that came with it and dab the sides there so it doesn't pool. But yes, very important, 3 minutes to wait. Along with fire safety, you have to remember these 2 acronyms. So they each stand for something. You have PASS and RACE. And a lot of times these will be on your certification exam. They expect you to know these things and what they stand for. If Joint Commission ever comes to your hospital, they may ask you, what does PASS mean? What does the A in PASS mean? To see if you know how to respond to a fire. So PASS stands for pull, aim, squeeze, sweep, which is referring to your fire extinguisher, how to use a fire extinguisher. So first you pull the pin that is like near the top of the handle. You're going to aim it at the base of the fire. That's important, at the base of the fire, because that's where the fire comes from. Okay, you want to stop it where it starts. And then you squeeze the handle as you're aiming. And then you're going to sweep that where you're aiming at the base of the fire back and forth. So as a sweeping motion to try to get it out. So pull, aim, squeeze, sweep. And then RACE stands for rescue, alert, contain, or extinguish. So rescue anybody that you can. You sound the alarm and call your fire department. Contain it by shutting all the doors. And most of the time in the hospitals, we have fire like fire barriers, fire doors that will shut as soon as the alarm goes off, no matter what, to contain it. But you can also shut doors too. And then extinguish, like with your fire extinguisher here, if you can, if it's small enough. If it's fully engulfed the entire room, just get out. There's no that fire extinguisher is not going to work. You need backup. All right, so our next environmental hazard, I guess you could say, or a hazard of the job, is going to be ionizing radiation, which is something that we can get from CR machines or 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 fluoroscopy type X-rays. All of those emit some sort of ionizing radiation, which can damage your tissue if you're exposed after long periods of time. You know, 1 or 2 quick shots on the patient is typically okay. We would still try to cover their vital organs, like these that are most at risk for being damaged, like the thyroid in your neck and your reproductive organs especially are the ones that are more susceptible to being damaged. If those cells in those areas become damaged over time, it can lead to cancer. So you always, if you're doing a case that you know has X-ray, it should tell you ahead of time. Sometimes it doesn't, but you can adjust. You will want to wear a lead apron. Okay, if you're doing an orthopedic case where you're fixing a bone, there's going to be X-ray. They have to make sure the bones are aligned. So you would wear a lead apron and a thyroid shield. Make sure you get if you've had your thyroid removed, then you don't need to, but most people will still have their thyroid. So the prevention here for ionizing radiation is 3 simple things: time, distance, and shielding. Those 3 things protect you from ionizing radiation. So the amount of time you're exposed, you obviously want to limit. The distance should be about 6 feet. If you can stand at least 6 feet away from the machine, theoretically you're safe. Okay. And shielding, like your lead apron, they also make like rolling, almost like a rolling wall sort of thing that people can stand behind if they don't have an apron on. So you'll see those in the room too. If you didn't know there was a case that would need X-ray, you could stand behind that instead of having to break scrub, putting on an apron, etc. Okay. Sorry, I should have moved this one up one. Fire risk management strategy. So going back to how can you as a surge tech prevent, how can you prevent forest fires? Fire risk. So we said the Bobby was definitely a heat source, right? It gets hot. You want to keep it in its holster if you're not using it. So it always comes with a holster. Don't throw the holster away. Clamp it onto the drape, put it on the drape somehow. Make sure the surgeon, or you'll probably have to do it for them, put it back in the holster when they're not using it. Keep it close to where they can grab it though. Always keep the Bobby tip clean of eschar. So eschar is this term for that burnt black tissue that gets built up on it. If you have a non-coated Bobby tip, you can get a Bobby scratch pad to clean it. If it's a coated Bobby tip, which most are anymore, you can wipe it off with like one of your blue towels or something. I keep the towel that I put on my mail, I keep the edge of it clean or clear so I can just use that corner to wipe things off with. If you don't keep this clear, as the Bobby's activated and it tries to go out the tip, it actually spreads the electric like current where it shouldn't, instead of like down the tip of the Bobby. So you have more risk of it like going where you don't want it to go. And then you also always, I don't care how long the case is, always have saline or stir water on your back table for this reason. I've seen so many texts like, no, I'll get saline if the doctor asks for it or something. To me, that's just kind of lazy. Just pour the saline and have it available for this reason. I have seen small fires start up in the OR. I mean, it's a blink of an eye. Like I had my back turned, maybe the surgeon unscrewed the fiber optic light cord from the camera and laid it on the drapes without thinking. I turned back and there's a tiny hole being burnt in the top of the drape. Then you can just grab your bucket of saline, toss it on there. Usually that covers it at that point. So always, if you don't use it at the end of the case, then you can just suction it up, whatever. It's not that big of a deal. So don't place, like I said, don't place fiber optic light cords, the tip of them, on the drape, because just in a few short seconds, it can catch the drapes on fire. And then, like we said before, let all prep solutions dry. Never let it pool. So a little bit more about lasers. These are just a few of the laser safety options. There's probably, you could probably, if you really wanted to, think about like 10, maybe 15 very specific things you can do for laser safety. Not all of it's pertaining to fire. It might be protecting the eyes, so the laser doesn't damage your eyeballs. But lasers, you have to be very careful with. Um, so you always want to keep the laser on standby when not in use. A lot of times the person in charge of the laser has been laser certified. They go through this special training. Some facilities will let surge techs do this. Depends on your facility. Always just, that's super important. And they will verify with the surgeon when they're ready. Or the surgeon may even say, okay, I'm ready. Okay. Place wet towels on the operative site. So if, we're lasering off maybe a mole or something cancerous, maybe melanoma, whatever it is, use, after the patient's been draped, use like 4 wet towels or laps, whatever it is, to square off that incision on top of the drape to cover that so it doesn't accidentally get burnt. Again, always have saline. Anesthesia will also use a laser-specific ET tube, kind of like I mentioned before, that is not prone to melting. There have been some pretty horrific airway fires in the operating room that I debated on whether to put a picture on. I decided against it because it's pretty rough. The patient literally can catch fire from the airway tube and get burnt into their lungs from the inside out. So a lot of times those patients don't make it. It's pretty rough. So we want to avoid that. And then always have the correct fire extinguisher available. A lot of times on your laser cart, there will be one, and there should also be one in the hallway close to all the operating rooms as well. So speaking of fire extinguishers, there isn't just one, okay? You may be surprised to learn that. There's different kinds of things in these canisters that are useful for better things. Like K is always easy for me to remember. K is for kitchen fires. K, right? A is actually for, if you think of ash, things that can turn to ash, like wood, cloth, paper, those things turn to ash. Then B is like, it says it could also be wood here on this one, but mostly like flammable liquids, electrical things. C is also good for electrical, decombustible metals. So just kind of remember those types of things. A lot of times they will ask letters on the certification exam, which one's good for what. So along with the bovie, not just a fire hazard, it also provides a very big health hazard. Surge techs are at a high risk of developing lung issues, okay? And the reason for that is this smoke plume, this bovie plume that is created from when the bovie is activated against the tissue. It creates smoke. If you've never smelled this, maybe you've never really been in the operating room and smelled, it's burning flesh is what it is. It's very distinct. Sometimes I think for students that's hard to get used to, but you really want to eliminate the smoke plume as much as possible, because as you're burning that tissue, let's say that tissue contained a virus. Those live virus in those cells can be in the smoke plume. And if you can smell something, it's in your nose. It doesn't matter what it is. If you can smell, let's say, something cooking, pieces of what you're cooking is actually going into your nose. That's science, okay? So be very cautious, and you can help prevent this. You can help suction up the smoke as the surgeon is using it. Sometimes they have bovies that now have a suction like built right into it. So it has a smoke evacuator built into it. For this reason, they've done a lot of studies on this now that shows how harmful this smoke plume is. It says daily exposure, just one day working in your operating room, and you've breathed in this bovie smoke all day, it equates to smoking 27 to 30 cigarettes a day. That is mind-blowing, okay? So I've known a lot of older surge techs that never really smoked a day in their life, but now they're getting up into their 50s and 60s, and they have chronic bronchitis. They are showing signs of COPD because they back in the day they didn't know anything about this. They didn't do studies on this type of thing. So unfortunately, now they're bearing the brunt of it. Okay, so really make sure you want to eliminate smoke plume as much as possible. It says a lot of guidelines now are really starting to crack down on this. Now, if you just use your normal suction that's hooked up to, let's say, your pool tip, and it's just going to a canister, that all that does is eliminate it from where you're working and puts it over to the canister. It's not being filtered, it's just moved somewhere else in the room. So you want to use a special smoke evacuator that has a filter like on it to filter it completely out of the room. So be wary of smoke plumes. Okay. So along with that, I do have a small video here from our surgical tech tips friend guy that explains it pretty well too.
We all know and understand the problems associated with smoke inhalation. But what about surgical smoke? Stay tuned. Surgical smoke, or plume, can be a pretty dangerous byproduct of energy device usage in the OR, day in and day out. Some examples could be monopolar, bipolar, and lasers. There's a multitude of other energy devices that we use in the OR that produce this plume, this surgical smoke. The most common one will probably be the Bovie. It's just monopolar cauterization. We use it day in and day out, pretty much on every single case that enters an operating room. And I'd have to say the monopolar cautery and laser usage probably produce the most amount of smoke in the operating room. Now, during surgery, plume can be pretty annoying, not only to the surgeons, but the assistants and the techs, residents, anybody that's really standing up at the field. The odor can be pretty bad at times. It stinks. But even more so than that, it can be pretty obstructing as far as viewing the tissue that you're actually working on. To be more specific, like lap choles, many surgeons that I've worked with in the past have used like a spatula monopolar cautery when taking down the gallbladder. And a lot of these surgeons are just so fast. I mean, some of these cases only take like 20 minutes, but you know, they have a grasper in there, they're holding the gallbladder, and they're just monopolar Bovie all the way up the back side of that gallbladder, taking it off the liver. And they're doing it so fast that there's just, the whole abdomen is like full of smoke, and it's like you can barely see what you're doing. I don't know how they do it sometimes, but it's important to have some things in place, especially on laparoscopic cases, to evacuate that smoke in a quick fashion so that they are able to keep a good visualization of the tissue they're working on. So who's at risk? Obviously everybody that's standing at the field. You and I are standing at the field. A surgeon, a resident, a nurse, whoever is standing at the field right there in the middle of surgery is at potential risk of inhaling, you know, these vapors, this plume. It's been shown that plume can contain toxic gases, vapors, viruses, bacteria. Probably an example of one of the most important cases for you to wear proper attire would be like an HPV patient and you're burning off like genital warts or something like that. It can be used with either monopolar or lasers, but the smoke produced from burning off those genital warts could transmit to other people in the room if you're not using the proper smoke evacuation and if you're not using the proper mask and attire for the case. So, how do we prevent these hazards? Because these hazards are easily preventable. Number one, use your suction. Every case that you're going to be working in, or that you are working in, has use of suction on the table. It's usually just a suction tubing and a Yankauer tip or whatever type of suction tip you're using. If the surgeon is working and burning through tissue, you have that suction nearby that incision, just sucking up that extra tissue smoke, that plume, so nobody at the table has to breathe in all of that vapor. Number 2 would be use a smoke evacuator. On those specific cases like HPV patients where you're burning off some genital warts and stuff like that, we have specific smoke evacuation machines, and some suction machines actually have smoke evacuation settings to them, but you can use that to help even more with getting that smoke out of the field and not in anybody's faces. Number 3, make sure your hospital has some sort of hazard markings that they utilize on their surgical schedules, just so the people that are working in that room know and understand that there is a hazard that is associated with this patient that they will be working on. Number 4, if you are in a hazardous case, use an N95 respirator mask. Everyone calls them TB masks, tuberculosis masks, but they're not only just used for TB patients. Use them on those HPV patients if you're going to be doing a wart removal. Put that mask on. I know it's hard to breathe through those masks and it's a pain in the butt, but you are preventing yourself from a potential hazard. You're doing it for yourself. Now, all that being said, I know tissue smoke and surgical smoke is nowhere near as harmful as like cigarette smoke. It's like 95 or 96% water, so surgical smoke is essentially like a vapor because our bodies are made up of that much water. So just cutting through tissue, you're basically cutting through water mostly. But I just want people to recognize the hazards, the potential hazards that could happen in the OR, depending on the cases that you see. So I hope you guys liked the video. If you did, please give it a share and a like, and I'll see you guys in the next one. Bye.
Well, I agree with him mostly in that video. The last little part I don't necessarily agree with because I think maybe since that particular video, a lot of studies have come out that says if you are in an operating room all day and you've breathed in that smoke plume all day, it is the equivalent of smoking 4 cigarettes. So it could be potentially more harmful than smoking cigarettes. So other than that, it's a good video. I just wanted to point that out to you. So if you have any questions on this week's assignments or anything, reach out to me. Here's my email. I do have office hours today or by appointment if something doesn't work for you. You guys are doing a good job so far. Keep up the good work. Keep getting those assignments in so you don't fall behind, right? We're almost halfway through, so keep up the good work.